Well, turning now to a pressing problem right across the country, and that is the need for ventilators as hospitals prepare for an influx of COVID-19 patients. According to federal health authorities, Canada right now has around 5,000 ventilators. Ontario has ordered an additional 300. Nova Scotia has ordered 140. New Brunswick is increasing its stock by 50%, and BC waiting for more as well, although they have not said how many. With more on what is needed, where the supplies are going to come from, we are joined by Andrew West. He is the CEO of the Canadian Society of Respiratory Therapists. Thanks for being with us on Your Morning.
Good morning, Emery. Thanks for having me.
We know the federal government has ordered 5,000 ventilators. Is it enough, and where will they come from?
Well, I would say in the first instance, we have approximately 5,000 ventilators on site in hospitals across Canada. That is actually the normal stock that exists in hospitals across Canada. So we know that those numbers are the appropriate number to manage a normal caseload through a normal year, which includes, of course, seasonal variation for things such as the flu. What we're unclear of at this point in time is if there is a surge, and of course we're expecting there to be a surge in patient load based on because of the COVID-19 crisis. We're not certain how large that surge will be. So we know that there are stockpiles in existence based on learnings from our experiences in the SARS and H1N1 pandemic. In the past, we have implemented local and provincial pandemic plans that include additional stockpiles of ventilators. So those are on site already, and our, what we have heard so far is that those have not been tapped into. So those remain available to assist with surges, as well as the federal stockpiles that are already in place and ready to be deployed anywhere across the country within 24 hours. So there's substantial stockpiles ready to be moved and brought into place should they be needed. And like I said, we anticipate they will at some time.
People are watching the news and they hear, the New York governor is ordering, it says they need 30,000 ventilators. And, doing interviews with doctors and with people in Italy who said that was the pressing need in hospitals, is they were having to make choices of, they have one respirator, two patients who need it, and having to make a life or death decision. Are we anywhere near that?
So what we're hearing from respiratory therapists across the country, and of course, respiratory therapists are the frontline providers of care for patients with ventilators, are requiring ventilators. We're not hearing that we're at that point now, for sure. We're certainly understanding that healthcare workers are very busy, and that ICUs we're reading reports that ICUs are starting to fill up, but we have not been hearing from them that they're at that point yet. And like I said, there are still stockpiles waiting, should they be needed to be deployed, that haven't been needed to be accessed at this point.
All right, Andrew West, we're going to continue to check in with you as the need increases here across the country. Thanks for joining us this morning.
Thank you very much.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.